Hello and welcome to the Pace Hospitals podcast. Today we are addressing a crucial topic that affects many people worldwide, that is hypertension or high blood pressure. Often referred to as the silent killer, hypertension doesn't always show symptoms, but it can lead to serious health complications like heart disease, stroke, and kidney failure if left unchecked. Joining us today is Dr. Snigdha Panaganti, General Physician at Pace Hospitals, Hyderabad, with extensive expertise in managing metabolic disorders, including hypertension. In this episode, Dr. Snigdha Panaganti guides us through an in-depth conversation on hypertension, including what it is, how it develops, why it is so dangerous, and most importantly, how it can be managed effectively. We'll also talk about lifestyle changes, medications, and monitoring strategies that can help you take control of your blood pressure and live a healthier life. So, if you are looking to better understand your health and take proactive steps to prevent the risk associated with high blood pressure, this episode is for you. Dr. Snigdha Panaganti, thank you for joining us today at Pace Hospitals, High Tech City. Let's start by understanding what is hypertension.
So in simple words, hypertension means high blood pressure. So when do we call high blood pressure? Usually we check blood pressure in numbers, as you everyone know. So we tie a cuff to our hand and check our blood pressure in the monitor. So blood pressure usually comes in two numbers. The upper number we call as systole and the lower number we call as diastole. So we call your blood pressure is on higher side when the blood pressure reading is more than 140 and 90 mmHg. Then what is the normal blood pressure? For person, especially adults, we say blood pressure is normal when it is less than 120 mmHg on the top and less than 80 on the bottom number. So blood pressure recording less than 120/80 is the normal blood pressure for any adult. Anything more than this is considered as elevated blood pressure and it is called hypertension when the blood pressure is above, the top number being more than 140 and the bottom number being more than 90 mmHg. So why is blood pressure so important? Why everybody keep checking the blood pressure repeatedly, and why do doctors stress a lot on controlling your blood pressure? So pressure, it's the pressure with which the blood flows in your body. So where is this pressure coming from? The heart is like a pump. It pushes the blood in your body. So with every heartbeat, a heart will constrict and then pushes the blood all over the body and then relaxes. So when it is constricting, it builds a pressure in the body with which the blood flows. So that's how blood pressure is going on. But when your blood pressure is elevated for very long duration of time, it affects your heart and it affects your eyes. Your vision will be decreased. Your kidneys, it start to function less and you produce less amount of urine. All the side effects happen because of not controlling your blood pressure properly. That is the reason why you need to keep an eye on your blood pressure starting very early age, like from 20 years. Every year, please check your blood pressure, and if it is elevated, do the measures accordingly and bring it into the control.
Dr. Snigdha Panaganti, what are normal blood pressure values?
So in an adult, normal blood pressure is below 120 and 80 mmHg. It's not one reading which should be normal. Every time, whenever you check, it should be less than 120/80. What I mean by whenever you check, you should always check your BP in a resting state. That means on the day when you are checking the blood pressure, you should be well rested. You should get good sleep that night and you should not drink alcohol or caffeine that day and should not exercise half an hour before taking your blood pressure. When all these are met and you check your blood pressure and your blood pressure reading is less than 120/80 mmHg, that means your blood pressure is currently at a normal range and you are doing good blood pressure wise.
So doctor, what is the difference between systolic and diastolic blood pressure?
So blood pressure, when I ask my patients to check the blood pressure at home and come back with the findings, what they do usually is they write the bottom number on the top and the top number on the bottom. So they reverse the values and bring it back to me. We understand. So in a rough estimate, you should always remember that the top number will be on the higher side compared to the bottom number. So what is top number called? It is called a systolic blood pressure, and the bottom number is called diastolic blood pressure. So why is the top number higher than the bottom number? So there's an explanation for this. So your heart, for every heartbeat, it will contract and it will relax. So when it contracts, it pushes the blood with pressure. So at that point of time, when we check the blood pressure, it will be little on higher side, which is usually 120. So that is the systolic blood pressure. So when the heart relaxes, the pushing force is reduced. So the blood pressure will be little lower than the top number, which is usually 80 mmHg. So next time when a doctor asks you to bring the blood pressure recordings, always make sure that you are writing the top number on the upper side and the bottom number on the lower side. So that will be an accurate measurement of blood pressure.
Could you explain what are the different stages of high blood pressure?
Whenever we do the blood pressure readings, the numbers are various numbers we get. We get sometimes 120, 130, 140, 160 on the top, and bottom would be 80, 90. So what are these numbers? How to analyze these numbers? For that, we have stages of hypertension. When we say normal blood pressure is less than 120 and less than 80 mmHg on the bottom, that's the normal blood pressure. But your blood pressure, if the top number, that is systolic blood pressure, is between 130 to 139, maintaining the diastolic blood pressure less than 80, still the upper number is little higher, 130 to 139. This is called elevated blood pressure. This is not hypertension yet, but it is an elevated blood pressure for you. So at this state, you have to start doing the lifestyle changes to get the blood pressure down to 120. This is called elevated blood pressure. There is another stage called stage 1 hypertension, is when your blood pressure is above 140 mmHg and the bottom number is above 90 mmHg, is stage 1 hypertension. At this stage, you already developed hypertension and you should seek the doctor advice immediately whether to start the medication or to go for lifestyle modification. And then comes the next stage, stage 2 hypertension, is when your blood pressure is significantly higher. The systolic blood pressure is more than 160 and the diastolic is more than 100 mmHg. At this stage, you have to be evaluated why your blood pressure is high and immediate medication should be started. And then there is another stage called very severe high blood pressure, is when your systolic is more than 180 and the diastolic is more than 100 mmHg. So 180 and 100 mmHg is a very high blood pressure. Sometimes few people come to us. They're absolutely fine, healthy adults, 40-45-year-old male. They come complaining with difficulty talking which developed suddenly. They were fine, all right, and in last 30 minutes they are unable to speak properly. Along with the speech, they also start to feeling weakness in one side of the body. They are unable to raise their arm. They are unable to walk properly. These are the symptoms of paralysis, which is stroke. In such cases, we measure the blood pressure and the blood pressure will be very high, more than 180 and 100 mmHg. This is called, because of high blood pressure, there is an end organ damage. Here, end organ being the brain. It could be either bleed or ischemic stroke. So patient developed stroke. This is called severe hypertension with end organ damage. In the same wise, with the high blood pressure, patient also can present with chest pain, shortness of breath, which is related to heart damage. And few people will present with blindness. This is because of the damage of your back of the eye. So there are these many stages of blood pressure. So to conclude, normal blood pressure is less than 120/80. Elevated blood pressure is between 130 to 139 systolic and the diastolic remaining less than 80. And stage 1 hypertension is the systole being 130 to 139 and diastole being 80 to 89. Stage 2 hypertension is 140 and above, and diastole is more than 190, and severe hypertension is when your blood pressure more than 180 systole and 100 diastole.
Dr. Snigdha Panuganti, what are the types of hypertensions?
Masked hypertension means it's like a mask. So when you check your blood pressure in the hospital, it will be normal. So we think it's normal blood pressure, but patient is having high blood pressure reading outside the hospital. At home, at his workplace, his blood pressure is usually on higher side, but only in the hospital his blood pressure is normal. In this case, what happens? Because we doctors see the hospital blood pressure reading and we think that patient's blood pressure is okay, and then it goes missing. The blood pressure recording, actual blood pressure recording goes missing. That is the home blood pressure, which is usually high, goes missing. That means there will be 2 to 3 years loss of treatment years. So when we don't give the treatment, his blood pressure is always elevated at home, and at the hospital, as it is normal, he is not on medication. So because of uncontrolled hypertension over few years, he develops all the damages. So damage to the retina, that is the back of the eye, there is a small layer where the vessels are very narrow. Because of the high blood pressure, these vessels get damaged and it affects the back of the retina, and his vision will be affected. And also because of heart pumping against the high blood pressure, heart muscle will become thick and it will become it functions less over a period of time. So to prevent all these damages, you should not rely only on the hospital blood pressure reading. You should also keep a monitor at home and keep checking, especially after 40 years of age. So we doctors, what do we do when a patient's blood pressure is normal, but patient is diabetic, patient has vision issues? An ECG can show that if your heart is enlarged or if your muscle has thickened. If we see any of those changes, or previously patient has a heart attack or previous stroke, paralysis, in those cases we ask the patient to check the blood pressure even at home to make sure we are not missing this masked hypertension. Yeah, so please keep a monitor at home, one monitor for all your family members. Once in a while, keep recording your blood pressure and write down on your paper, and when you come for the consultations, get it with you. So let's talk about resistant hypertension. Resistance means it's very hard to get the blood pressure under control. So why is this resistant hypertension? Because in young adults especially, sometimes there will be an underlying cause for developing the high blood pressure. So if we treat only high blood pressure, it is very difficult to control the blood pressure. Even if we give 3 different classes of medications, blood pressure still continues to be on a higher side. So this is called resistant hypertension, where 3 different classes of medication also, your blood pressure is still on very high side. It is becoming very difficult to bring it down. So this is called resistant hypertension. Why it happens? There are certain conditions where, especially in young adults who develop blood pressure just before puberty or just after the puberty in 20s, there might be some hormonal issues which causes the rise in blood pressure. Until we treat those hormonal issues, this blood pressure is very difficult to bring under control. So let's look at what are those hormonal issues, which is, first one is Cushing's disease. Cushing's disease, where the body is producing lot of steroids, which is not necessary, because one of the gland called adrenal gland is functioning hyperactively, which is not necessary. It's pathological. So when the lot of steroids are pumped into your blood, these persons they get moon-shaped face and they become puffed up, gain lot of weight. Along with that, they have high blood pressure also. And there is another condition called primary hyperaldosteronism. In this, there is a small gland sitting on the top of your kidney called adrenal gland. This produces aldosterone in excess, not required. So this is also a problem in the hormone. Until you correct this hyperaldosteronism, your blood pressure always remains on the higher side. And sometimes in some individuals, there is an artery called renal artery. which supplies the blood to the kidney. This renal artery can get blocked, and that causes high blood pressure. So until you correct this block, the blood pressure remains on the higher side. And then there is also another called aorta. As everybody know, aorta is the main artery which takes the blood from the heart and supplies it all over the body. So sometimes in some individuals, aorta can get very narrowed. That increases the blood pressure. So these are all some of the causes for high blood pressure. These are the rare causes which I mentioned. The most common causes are people are not using the medication regularly. They keep skipping the medication or they wantedly avoid the medication, and few people come to me saying that they take medication only when the blood pressure is higher side. That means they can't keep checking the blood pressure 24 hours, right? So they check today in the morning, they take one tablet and then leave it tomorrow and check day after tomorrow and take a tablet. That is very unhealthy way of using medications. So that's the one of the reasons for having high blood pressure. So compliance, using medication on time every day as suggested by doctor, is very important. One more thing is high alcohol consumption. If you consume alcohol every day, more than 2 glasses of alcohol or whatever quantity of alcohol, you are at risk of developing uncontrolled hypertension. Smoking is also one of the risk factor. Consuming high salt diet. So highly processed food has high salt diet. So all of these are the reasons for resistant hypertension. That's the reason whenever an young individuals in 20 years of age develop hypertension, we do a scan of your abdomen to find out if the renal artery is functioning properly or not, and to see if the adrenal gland has any mass or any enlargement. And we'll take an ECG to make sure your heart muscle is preserved and functioning normally. And we also check back of your eye to make sure everything is proper and we are not missing out the secondary causes of hypertension.
So doctor, what causes hypertension in adults?
Now let's discuss about what causes hypertension in adults. So causes means it can occur because of the aging, smoking, obesity, alcohol, no physical activity, lack of physical activity, lack of sleep. All this can contribute you to develop hypertension over a period of time. These are all what we do to our body. And there are certain other conditions, especially with the secondary hypertension. There are few conditions which predisposes the patient to develop high blood pressure, like what I said, primary hyperaldosteronism, where the hormone secretion is high, especially aldosterone hormone. Renal artery stenosis, the renal artery which supplies the kidney is blocked. That causes hypertension. Coarctation of aorta. That means the main blood vessel aorta is getting narrowed. That causes hypertension. And then there is people consuming severe heavy alcohol drinkers, smokers, chain smokers who have been smoking for a long period of time. All this can cause you to develop hypertension. Among these few causes like hormonal causes, if identified, if we treat those secondary causes, we can stop your hypertension. But most of the other causes, 80% of the time, if you develop hypertension, there won't be any underlying cause. It is usually primary hypertension and you should be on medications. But if you control the causes, these are the causes like I said, all the software employees who sit long hours, who work and then come back home, sleep, again next day work, they all lack physical activity. They sleep very less. Because of long hours of sitting, they develop obesity. And what they consume, highly processed food, burgers, pizzas, all this, high salt intake. And what happens over the weekend? Alcohol consumption. The perfect lifestyle required to develop hypertension. So if you control all these things, your hypertension risk will be greatly reduced.
Can you explain what are the risk factors of hypertension?
Hypertension is high blood pressure. So in simple words, why is a person developing high blood pressure? For this, we call risk factors. That means there are some things. For example, if you take pollution, it didn't develop in a day or two. It developed over a period of time because of multiple factors like deforestation, pollution, car pollution, factories. All of this contributed to pollution to develop over years. Similar way, in your body, high blood pressure develops over a period of time due to multiple reasons. And the reasons are the risk factors. One is aging. Aging means with age, your arteries your blood vessels stiffen up and the blood pressure increases. This is a non-modifiable risk factor, means you cannot stop aging. Age will progress. So this is non-modifiable. You cannot change anything about aging. And sex. Usually males are at higher risk of developing hypertension. And the next is family history. If one or both the parents have hypertension, there is a 30 to 50% chance of you developing hypertension at any stage in your life. Next is, these are all non-modifiable. You cannot control aging. You cannot control your parents having hypertension or not. So these are non-modifiable. You cannot work on these factors. But there are modifiable risk factors on which, if you work, you can control your risk of developing blood pressure. Obesity. If you are overweight, your blood pressure will be on higher side. It will slowly increase, and you will at some point you'll start developing hypertension, which needed medications. And smoking is one of the deadliest thing you can do to your health. It will affect your blood pressure, affect your heart, affect your lungs. So quit smoking. And alcohol. If you continue to take alcohol has shown to have very bad effects on your blood pressure. It will affect your cholesterol, it will affect your digestion, it will mess up all the systems in your body. And then high salt diet. If you consume a lot of salt every day in your food items, in the processed food, fried items, all of this can contribute to high blood pressure. So these are, and also having very little sleep. If a person is sleeping less than 6 hours in a day, like that, continuing like that for a long period of time, he will develop hypertension at some point of time. So all these are modifiable risk factors. If you can do lifestyle changes to prevent obesity, take less salt, and exercise every day, and also not smoke, not take alcohol, and sleep properly, your risk of developing hypertension will be far reduced.
Dr. Snigdha Panuganti, what are the common symptoms of uncontrolled hypertension?
Now let's talk about what are the common symptoms of uncontrolled hypertension. I'll give you an example. A patient comes to me with a blood pressure recording of 160/100, which is very high. So when I tell him that check the 3 days blood pressure, all the readings are on higher side. Now I advise him to go on a medication because it is on higher side. What the patient says, doctor, I am completely fine. I have no problem with this blood pressure. I have no headache, no giddiness, no problem at all. Is it required me to take the medication? Yeah, still you need to take the medication, because 85% of the time, even if you are having very high blood pressure, you will not have any symptoms. This is most commonly seen. So that's the reason you have to check your blood pressure frequently, every year at least, to make sure it is under control. Even if you have no symptoms, with the high blood pressure reading, you have to get treated. So if there are symptoms, what can it be? With very high blood pressure, patient can have headache, mainly occipital. That means back of your head, there will be lot of pain, headache, and then you can have nosebleeds, because the small vessels in your nose will get bursted because of the high blood pressure, and you start to have nosebleeds. And few people, this is not a symptom, but when the doctor checks an ECG, it will show that your heart muscle has thickened, especially left ventricle, which is called left ventricle hypertrophy. So the heart muscle gets thickened if the blood pressure is not controlled for a long time. And patient can develop with uncontrolled blood pressure blindness, not the complete blindness, but reduced vision. It's not the vision problem which everybody has, long distance vision problem. This is a vision problem which cannot be treated with the spectacles. Even if you wear the glasses, your vision will be reduced. So this is the problem with the retina. Back of your eye, the layer has damaged because of high uncontrolled blood pressure. So these, along with this, you can develop proteinuria. Kidney might be damaged and your urine start to froth, or you can pass urine which is little whitish. So we need to check your complete urine examination to make sure you are not losing protein in the kidney. So all these are the symptoms: headache, nosebleeds, heart muscle can thicken over time, and also your vision will be reduced, and also your kidney will be affected. So make sure that your blood pressure is under control to prevent all these dangerous symptoms you develop.
So, doctor, how is hypertension diagnosed?
So now let's talk about how is hypertension diagnosed. That means now we are making the diagnosis of hypertension for a patient. With one reading, we cannot make the diagnosis. We need multiple readings over multiple days to make the diagnosis. So what is the reading that is required to make the diagnosis? If your blood pressure is more than 140 by 90 mmHg, we call it hypertension, but it should not be a single reading. If you take blood pressure for suppose today, please check your blood pressure tomorrow when you are well rested, and also day after tomorrow. Now with the 3 readings, we see the average reading. So on a first day, if it is 140/90, and next day also it is high, and the third day also all the 3 readings are on higher side, then we diagnose as high blood pressure, which is hypertension. Very important way how you check your blood pressure. To check your blood pressure, you should come very relaxedly to the hospital. Don't rush the parking, don't rush to the appointment. Come relaxedly, take your ample of time before consulting a doctor. So come sit very quietly and don't panic. Don't go up and down the stairs. Don't smoke. Don't drink at night before this blood checkup, and get good 7 hours of sleep the day before. So after maintaining all this, come to the hospital for the appointment in a very calm state. Don't panic and come relaxedly. Don't be in a hurry and don't be late to the appointment. And if you have any questions, write all the questions so that you will not be anxious about asking the questions. So preparing all these things a day before, and then on the day of visit, sit quietly and then check the blood pressure. While checking the blood pressure, don't talk. So that's how you have to check the blood pressure every single time. And to diagnose, we need 3 different readings on 3 different visits. Only then we diagnose your hypertension.
Could you explain what are the treatments available for hypertension?
Now let's talk about what are the treatment options available for treating hypertension. So whenever we say the treatment options, it does not start with the tablets. It starts with the lifestyle. So it starts with the lifestyle modification. So what are the lifestyle modifications that you can do to control the blood pressure, or to control the number of tablets you need to get the blood pressure down? So for suppose your blood pressure, you are around 40 years of age, and this is the first time that we diagnosed you as having high blood pressure, and your blood pressure readings are just nearby 140/90, just starting to have high blood pressure. At this stage, you can do lifestyle modifications and try to bring the blood pressure under control. So what lifestyle measures you can take? First thing, if you are obese or if you are overweight, you have to exercise every day. You have to make sure that gradually, slowly, you should lose your weight. That is the best thing that you can do to control your blood pressure. Controlling your weight. If you are smoking, quit. If you are taking alcohol, limit your alcohol intake. Get 7 hours of sleep. These are the minimum basic things that you need to do. Then comes the diet. So for hypertension, there is a specific diet called DASH diet. DASH. It stands for Dietary Approach to Stop Hypertension. That means in this kind of diet, you should consume lot of vegetables and fruits, less salt intake, less processed food, and lot of whole grains. If you take all of these things, this has naturally high potassium, magnesium, calcium, and low saturated fats. In this way, your hypertension will come under control. This is the diet. And coming to the exercise, you have to do aerobic exercise. That means brisk walking, running, or yoga, or physical activity of at least 1 hour every day to control the hypertension. That is about physical activity. And then get 7 hours of sleep. So these are all the lifestyle changes that you can do to control the blood pressure in the initial stages, or even when you are on tablets. By doing these lifestyle changes, you can reduce the number of medications you are requiring to get the blood pressure down. Then comes the tablets, the medication that we give to control the blood pressure. So when do we give medications? If your blood pressure is above 140/90 on multiple occasions and your risk of heart disease is high, then we have to start immediately along with the lifestyle changes. If you are diabetic, if you have a heart issue, or if you have high cholesterol, all these are risk factors for heart disease, and now your blood pressure is more than 140/90, immediately start the medication and also do the lifestyle changes, because you have all other risk factors, diabetes, diabetes, high cholesterol. All this will contribute to bad heart health. So to prevent further damage to the heart, it is better to start medication early and control it.
Dr. Snigdha Panuganti, one final question. What are the preventive tips for hypertension?
So let's talk about what are the preventive steps you can take to prevent development of hypertension. So first thing is diet. As I said, follow DASH diet from early stage. Even when you have no hypertension, you have to consume less salt, less processed food, and more vegetables, whole grains. This is important diet wise. And then if you are smoking, alcohol, these two are very bad. People who are consuming alcohol should definitely limit the alcohol intake, and people who are not drinking, please don't start drinking alcohol. Smoking, please reduce the number of cigarettes if you can, or completely quit the smoking habit. And exercise every day. Exercise, I cannot emphasize so much on exercise, because exercise is very important. Physical inactivity will definitely contribute to high blood pressure. Exercise every day for 1 hour, whatever kind of exercise you are comfortable with. Please do the exercises. And then sleep. Sleep is very important. There was a study where over 15 years of period, 2 lakh people were observed who were having a sleep less than 6 hours. Over the period of time, they start to develop hypertension, high cholesterol, diabetes. So sleep is very important. If you are not having more than 7 hours of sleep, you are at risk of developing hypertension. Then comes stress. So in day-to-day life, stress is a major part of our life. So to control the stress, we have to be mindful, do meditation, yoga, and play some games which will help you with stress relief. So if you do all of these lifestyle changes and maintain a healthy lifestyle, and also from 20 years of age, start checking your blood pressure every year. And if you have risk factors like family history of hypertension, or you are obese, or you are already suffering with diabetes, check more frequently.
Thank you, Dr. Snigdha Panuganti, for sharing crucial information regarding hypertension. We hope this episode has helped you understand the importance of managing hypertension. It may not always show symptoms, but unchecked high blood pressure can lead to serious health issues like heart disease and stroke. If you are concerned about your blood pressure, don't hesitate to consult a general physician. Early detection and lifestyle changes can make a significant difference. Thank you for tuning into the PACE Hospitals podcast. Stay tuned for more health tips and insights. Until next time, keep your blood pressure in check and live a heart-healthy life.